Medical tourism in the face of being quarantined. For the rest of the world, we have to adopt new ways of going through life. But for the case of Dr. Maria Arqué, a very good friend of mine from Fertty International, it's almost business as usual for your clinic, isn't it?
Yeah, in fact, we have been working that way since the very beginning because we're mainly focused on international patients. So usually our first contact with most of our patients is through telemedicine. So this is one of the advantages in this current situation that we are so used to work that way.
I think that's wonderful. You haven't really had to adjust typical business operations like a lot of clinics have been struggling to adjust business operations. Some of them were so ill prepared that they even stopped their marketing outreach to patients, which is kind of devastating as a patient advocate because the same patients that needed you all yesterday still need you today. So the difference is really about timing, right? You're not doing egg retrievals and you're not doing embryo transfers, but there's so much that you can get done that there's very little disruption.
Absolutely, exactly. We are, as most of the fertility clinics, following the recommendations both from the American Society of Reproductive Medicine and the European Society, which are that we don't start any new treatment at the moment and we don't undergo any egg collections, neither embryo transfers until we know more about the COVID-19 and until the pandemic is more controlled. But as I tell to all patients, undergoing a fertility treatment, usually it's kind of a journey or a process, and usually there's kind of a lot of time that it's required to get prepared for it. So I think that now it's this situation is giving us an opportunity to get ready for it.
That's
So
right.
one of the things that can be done is an initial consultation. That this can absolutely be done online with your doctor through telemedicine to make an initial assessment of your situation and see which would be the test that you need to get done. Hopefully and most likely part of this test or most of these tests you will be able to do them in the meantime, and then you can have a review, also online consultation about the results to discuss which would be your treatment options. And also this is, on the other hand, a great opportunity to focus on lifestyle and nutrition to get more prepared for a fertility treatment as well, I think.
Well, which is really unique about you because not only are you an IVF doctor, but you also have a doctorate in nutrigenomics.
Yeah.
Right. So
So
you bring such a unique perspective to the patient experience. Can you share with us a little bit about how you incorporate that part of your background into your patient care?
So basically, in part of the medical history that we do in the initial consultation, I also spend a lot of time asking up my patients about their lifestyle and their diet and seeing which are the things that we can improve to try to enhance their likelihood of having a successful outcome with their fertility treatment. And in some specific cases, depending on which is the situation, there might be some nutrition genetic tests that might be done.
And I think probably we have to encourage patients to be as honest as possible on that part of the intake form, right? Because I feel like people go into their primary care doctor or their regular doctor and they might not admit how much alcohol they drink per week, or they might not admit just how much fast food they eat per week. How do you make sure that what you're getting is kind of the most accurate picture?
You are completely right about that, Alice. In fact, most of us, when we are going to the doctor or someone is asking us about our weight and height, we are all taller, slimmer. We all drink less alcohol and have a better diet. You know, I try to be as empathic as possible with patients, and I try to build an environment in which they feel safe and secure to tell me the truth, and also I try to make them understand how important it is that they are honest, because at the end of the day, this is for their benefit. We're trying to enhance their likelihood of achieving a successful outcome with the fertility treatment. So that's the only way.
That
The
right.
only other way that you can know that they are telling you the truth is monitoring, and there's no possibility of doing that. It's a matter of making people aware of how important it is to educate people. I think that information and knowledge is powerful. So that's the way that I try to get patients to do that.
And what I love about your model is that it's so educational and informational, and that there's so much education that goes into understanding the fertility treatment options themselves, let alone there's a learning curve for every person who's going through this about their own body, about the impact of nutrition on fertility outcomes, on the impact of lifestyle. I think for me, I always maybe said that I was a lot more active than I really was on my intake forms. That activity levels really matter. And take us through what kind of step-by-step it looks like if somebody is going to get started today, when they have an initial consultation with you. How many steps are kind of involved, and how much is the average length of time just to get to the egg retrieval, just to get to almost the starting point? There's so many pre-steps involved. Can you kind of walk us through a little bit of procedurally of like what steps are actually involved?
Absolutely. So usually it all starts with an initial online consultation in which we do as I was saying, it's a consultation that maybe lasts for an hour or so, in which we do a very detailed medical history of the couple, and going through everything, obviously going through all the fertility as well, and the lifestyle, and then we make an assessment of which would be the possible scenarios of treatment options that we could consider, and which would be the test that we require before we make any decisions. Obviously, that can vary a lot between patients, because there are patients who are completely naive in the sense of fertility, which maybe it's their first experience, and I have patients that maybe they have already done 10 IVF cycles and 2 egg donation cycles.
Wow.
So it really depends on that. Usually in between the first consultation and the second consultation to assess the results, it really varies depending on which are the tests that we requested. But I'd say that it's between 2 weeks and maximum 1 month. There are no tests that would take longer than a month, maybe. And then we do another assessment of the situation, and we make already a plan. As our patients are international, it is crucial for them that we make a very detailed planning on when they need to come to the clinic, and that we try to minimize the amount of time that they have to spend in Barcelona, unless they want to take a vacation and make the most out of the fact that they have to come. But otherwise, we try to minimize the time that they have to be there. For example, for egg donation treatments, most of the times what we ask them is to come over to freeze a sperm sample, or maybe to ship the sperm sample frozen. And then what we do is create the embryos. And once we have the embryos at the blastocyst stage, and we have the certainty that we have good quality embryos for transfer, then what would happen is that we would start the endometrial preparation. While the patient is still in her country, she will do the scans that are required with her doctor there. And once she's ready for the transfer, she would come to spend only 1 day in Barcelona to make things.
That's amazing. And I think it's really important to note that you've been doing this all over Europe, right? You've been serving patients all over Europe for a very long time. This is standard. You treat patients from France and Germany and the UK, kind of all over the place, and it's not different if someone is starting in the US and going. It's a little bit longer of a flight. That's really the only difference, is that it's a little bit longer of a flight.
Exactly. That's the only difference. And usually the timeline between that time that we already have all the results until we can already do the embryo transfer, in the case that we're speaking about egg donation, it would be maximum 3 months. Okay. And then we're speaking about cycles in which what we're going to do is fertility preservation or an IVF cycle. Usually the timeline is a little bit shorter, because as soon as we have the results of all the tests, with the next period, we can already start.
Right.
For egg freezing, usually what we recommend is to come to do at least the last scan in our clinic, and to stay at least until the day after the egg collections. I don't let patients fly the same day of the egg collection, because I want to make sure that they are still in Barcelona, because if they were not feeling well, there was any complication, something, that they are here. And with patients who are about to do IVF, they have to come at least also, if possible, for the last scan here, stay for the egg collection, and then until 5 days after that, it's when we will have the embryos at the blastocyst stage and do the embryo transfer, which would be around 8 days, more or less. And in the case that they want to do PGT, most likely what we would recommend is that they come 2 times, 1 time for the egg collection, and then another time once we already have the results of the embryos for the embryo transfer.
So in that case,
we have several patients from the US have already done that, and everything worked fine.
So in that case, you genetically test the embryos, PGT-A. So you would genetically test the embryos, but you would end up with a frozen embryo cycle, so that the timing is easier. Is that what you're kind of recommending? Got it. Okay, which is great.
Yeah. There is also a possibility of doing the PGT Express, which means that on the same day 5, when you have the embryos, you can already do the biopsy and then do the embryo transfer the following day. But these, from the technical perspective, can have some limitations. Sometimes not all the embryos reach the blastocyst stage at the same phase, which means that maybe the embryos are not at the optimal stage to do the biopsy at the same time. That sometimes cannot be the optimal way to proceed. So that's why I usually recommend, if possible, to be able to do it the other way around.
Okay. Now I know that you have business people handling the business side of things, but is there a fee for the initial consultation? And then if there is it rolled into the cycle if someone proceeds with the clinic?
Mm-hmm. No, our initial consultations are on the initial assessment is free. We do free online consultations. This is something probably in the US might sound very weird, but here in Spain, this is something that most of the fertility clinics offer. So yeah, we do the initial assessment of the case, and then obviously there would be no additional cost afterwards if you decide to undergo the treatment with us.
Okay, that's incredible. The other thing that I just want to say is that we really love the refund guarantee program that Fertty offers. And there's a refund, if people qualify, there's a refund guarantee program for an IVF, for 3 IVF cycles, and a refund guarantee program for egg donor cycles. And I think the really unique thing about it, and I haven't seen it in any other clinic, is it's a live birth guarantee, whereas a lot of other pregnants are about a pregnancy guarantee. And that sets you guys apart. I mean, I think it's such an extraordinary offering. It's like, okay, I can go into this knowing if I qualify for this baby, that it's a partnership between me and the clinic. And we're going to make sure that I have that ultimate dream of holding, my newborn in my arms. That is just amazing. I would love to know, Maria, what was it that drew you to reproductive medicine in the first place?
What is that brought me to reproductive medicine?
Yeah, what was it about?
When I was already doing my internship or residency of OBGYN since the first year that I started, I was very amazed with endocrinology and people who were struggling to get pregnant. And I was very lucky because I've trained in a hospital where all the infertility team were people leading here in Europe, like very well-known people doing a lot of research. And I had a lot of people around that really were my mentors, and they really made me love it. And then it was a moment in which I realized that it made me the happiest person when I could be there just helping people to achieve their dreams and making them parents. So that's when I already decided that. So it's kind of a long time ago already.
It's amazing. It's amazing. But there are highs and lows in our field. The highs, of course, when your patient realizes their dream, but it's not always easy to get to there. And absolutely. I think, how do you cope with that?
Yeah, I think that probably one of the most challenging parts of our work is when you have to give bad news to patients, or when you have patients that they have kept on trying and that they are not achieving a positive result. And obviously our field is not easy in that sense, because the chances of success, generally speaking, are not that high for most of the treatments. Human fertility is already not that high, so you have to cope with that, and there's a lot of emotions involved. We're speaking about something that is very important for the life of people. We're speaking about building their family. It's something it's crucial in the life of someone, and there's a lot of emotions that are involved, and it really depends on what is the situation of the couple or the patient, if they have coping coping skills to know how to deal with the situation. So I do my best to try to be as empathic as possible and try to understand what they are going through. And I try to explain everything in the most simple and objective way possible to make them feel to keep things simple for them. And I also try to humanize the process as much as possible. I think that a lot of times one of the things that can happen with fertility is that the process can get very dehumanized, like very only medical. And I think that there is much more going on in the people who are going through the fertility treatment. I think that one of the things that patients value the most is when they feel like you care about them. It's not like one other case, you know. And they feel like you are accompanying them along all the journey, and you are there for them whenever they are having difficult moments. Like if a patient is having a miscarriage, call her and ask her how she is, and just listen to her. Probably she only needs to that you listen to her. And sometimes you see a patient in the clinic and they just need a hug, and that's it. That's what they need. So give that to them.
I need a hug right now. Most is just getting hugs.
No, I know. But this is one of the most important things.
I agree. I love that so much. I think that is the thing that sets you apart as a physician so much, is the humanity that you're bringing into the conversation, that the human connection. You're so empathetic, you know, and kindness goes such a long way. You know, it really does in you know, the bedside manner, right? That's what we call it in the US. It's the bedside manner. And you have so much of it. So I'd like to just encourage, you know, our patients and our users, you know, this is such a great opportunity to get the education, the information that you need to get on course with a timeline that you can plan for. And let's be honest, right now, travel prices are at an all-time low, and all the airlines are offering no change fees if you have to change. So I think it's a great opportunity for people to book medical tourism, knowing that they actually have the flexibility to change flights without penalty, and to get flights booked at a just like bottomed out price. So this could be like the best possible time to plan for a medical tourism visit, knowing that you might have to change a timeline, but knowing that you still head into it with a refund guarantee program for that live birth. And it might not happen in the exact time frame that everyone thought this year, but that it actually still will happen. And I think that's the takeaway message, is to leave everyone with that bit of hope, is that there's no time like the present to actually get the process started with that initial consultation. I want to thank you, Maria, so much for being an amazing provider, both with Fertility Answers platform and being available to answer questions, and just in your practice in general. Our patients are always incredibly happy to see you and talk to you. Thank you so much.
Thank you.
All right. Take good care.
You too. Stay safe.